Hello everyone, I'm Simarjeet, registered nurse again. So today I'm going to discuss about the complication of diabetes mellitus. So everybody knows about the diabetes. There is type 1 and type 2 diabetes, but few people only knows about the complication of diabetes mellitus. So what happen if a person have a diabetes, like what the complication can happen? So there is first one is the diabetic retinopathy can happen. What happen like if person have diabetes mellitus, or how the retinopathy can happen? So it affect the retina, like it affect our eyes, like blindness can happen. So when a person have more sugar level in the blood, it can deposit in the blood vessels, then it can damage the blood vessels. So it can damage small or large blood vessels. If they damage the small blood vessel, it can goes to the eyes blood vessels, then it can damage our retina, and it can cause the retinopathy. And next one is stroke. How the stroke can happen? So stroke is like brain hemorrhage. So when there is no blood supply to blood in the body, and there will be no blood supply goes to the brain, so it can damage the blood vessel throughout the brain too, if the blood sugar is deposited in the vessels. So it can cause the stroke and also cause the paralysis on one or both sided of the body. So it depends where the damage happen. Like it can damage the one side, or it can damage the both side, or vision, or maybe other losses like eye vision can lost, or hearing can get lost, or speech can get lost. So it depends like which vessels get damaged. So next is ischemic heart disease. We can say the heart failure or heart attack. It's like there is no blood supply and there is no oxygen when there is blood sugar in the blood. So that's causing the ischemic heart disease, like heart attack can happen. So that's also the most common cause, ischemic heart disease caused by the diabetes too. So renal failure, so that is also causing the small vessels of the kidney, like damage of the small vessels of the kidney, that's causing the renal failure. Like there is no blood supply to the renal through the renal vessels, also causing the renal failure too. And also peripheral vascular disease. In the peripheral vascular disease, there is also blood vessels got damaged because of deposit of the sugar, or we can say glucose. And in peripheral vascular disease, we already saw many patients, they have the diabetic foot, like gangrene can happen. And also when there is blood vessel damage, they can't sense the like pain or anything like heat or cold, and that's causing the infection and abscess formation. And also like they have foot problem, like they have ulcers and other problems can happen. That is the peripheral vascular disease. So these all the complications can happen if the patient have diabetes mellitus, like diabetes retinopathy, stroke, ischemic heart disease, renal failure, and peripheral vascular disease can happen. So this is all about today, like complication of diabetes mellitus. Please like and subscribe my channel, and see you next video. Thank you.